So hello guys, we left from here. Otitis media. Otitis media is the inflammation of middle ear, most commonly due to non-typable Haemophilus influenza, Streptococcus pneumoniae, Moraxilla catarrhalis, associated with eustachian tube dysfunction, as it opens in the middle ear, which promote overgrowth of bacterial colonizers of upper respiratory tract. Usually seen in children less than 2 years of age, presents with fever, otalgia means pain in the ear, hearing loss, physical exam shows bulging erythematous tympanic membrane that may rupture in sometimes. It may also complicate into mastoiditis. It is the infection of mastoid process of temporal bone, complication of acute otitis media due to continuity of middle ear cavity with mastoid ear cells, present with post-auricular pain, erythema, swelling, and may lead to brain abscess. So the next thing is common causes of hearing loss, noise-induced hearing loss, damage to stereociliated cilia in the organ of Cordy, loss of high frequency hearing first, sudden extremely loud noise can produce hearing loss due to tympanic membrane rupture. So noise induced hearing loss, it may result from the rupture of tympanic membrane. Presbycusis, aging related progressive bilateral symmetric sensory neural hearing loss, often of higher frequency due to destruction of hair cell at the cochlear base. So presbycusis is the age-related progressive bilateral symmetric sensory neural hearing loss. So first of all, it is age-related, then it is progressive, bilateral, and sensory neural hearing loss, often of higher frequencies due to destruction of hair cells the cochlear base, at the cochlear base. Preserved low frequency hearing at apex. So diagnosing hearing loss, you can see here that Weber test normal, there is no localization. When conductive hearing loss localizes to the affected ear, and in sensory neural hearing loss it localizes to unaffected ear, decreased transmission of all sounds, decreased transmission of background noise. Rene test, it it is done with the tuning fork. So in normal, air conduction is greater than bone conduction, and when there is conductive hearing loss, then bone conduction is greater than air conduction, and when there is sensory neural hearing loss, then air conduction is greater than bone conduction, which relate to the normal values. So we have to compare two ears in this test. What is cholesteatoma? It is abnormal growth of keratinized squamous epithelium in the middle ear. Skin in wrong place. So it is the overgrowth of skin like keratinized squamous epithelium in the middle ear, usually acquired but can be congenital. Primary acquired result from tympanic membrane retraction, pockets that form due to eustachian tube dysfunction. Secondary acquired results from tympanic membrane perforation, e.g. due to otitis media, that permits migration of squamous epithelium to the middle ear. Classically presents with painless otorrhea, may erode ossicles, conductive hearing loss. So one thing to remember is that if any disease erode ossicle, the deafness we will get would be conductive hearing loss type. So the next is vertigo. Vertigo is the sensation of spinning while actually stationary. So in this complaint, a patient may say that मुझे चक्कर आ रहे हैं. So subtype of dizziness but distinct from the lightheadedness. Peripheral vertigo is more common than central vertigo. So peripheral vertigo means that the ear related vertigo, you can see here peripheral vertigo due to inner ear pathology such as semilunar canal debris, benign paroxysmal positional vertigo, vestibular neuritis, Meniere's disease, endolymphatic hydrops, increase endolymph in the inner ear. There is triad of vertigo, sensory neural hearing loss, and tinnitus. Men wears vests. Finding mixed. The finding we will get is mixed horizontal torsional nystagmus, never purely torsional or vertical, that does not change direction and is suppressible with visual fixation. So very complicated finding is that mixed horizontal torsional nystagmus that does not change direction and is suppressible. We can suppress the nystagmus when we give target to the eye. So this is the main point of this vertigo. Central vertigo due to the brainstem or cerebellar lesion, stroke affecting the cerebral vestibular nuclei, demyelinating diseases or posterior fossa tumors. Finding nystagmus of any direction that is not suppressible with visual fixation. So in this we even if give target to the vision, there would be no suppression of the nystagmus. Neurologic findings would include diplopia, ataxia, and dysmetria, as these are also the other symptoms of cerebellar lesion. So we will also get these symptoms. In peripheral vertigo, we will get mixed symptoms of vertigo, sensory neural hearing loss, and tinnitus. And in central vertigo, we can get diplopia, ataxia, and dysmetria. So this is the neurology of eye. You can see here in front of it is the pupil, which is the distance between the iris to, you can see the iris. Anterior chamber, you can see here above the ahead of the lens is the anterior chamber, and this is the posterior chamber, and this is the lens, zonular fibers which hold the lens, and the ciliary bodies which hold the ciliary muscles. This is cornea, and this is iris. The anterior chamber and posterior chamber collectively are known as anterior segment, and the area behind the lens, which is also called vitreous chamber, is called posterior segment. You can see here the optic disc, which have the exit point of the optic nerve, vein, and artery. So this is sclera, this is choroid, this is retina, this is fovea, this is the optic nerve in the central retinal vein and central retinal artery. So conjunctivitis, it is the inflammation of the conjunctiva, red eye, allergic, itchy eye, bilateral. Bilateral mean pus, treat with antibiotics. Viral, most common, often adenovirus, sparse mucus discharge, swollen periauricular node, increase lacrimation, self-resolving. So these are the feature of allergic, bacterial and the viral. Most common virus is adenovirus. Refractive error. Common causes of impaired vision, correctable with glasses. Hyperopia, also called farsightedness. Eye too short for refractive power of cornea and lens. Light focused behind the retina, correct with convex converging lenses. Hyperopia, also called farsightedness. Eye too short for refractive power of cornea and lens. Light focused behind the retina, correct with convex lens. So in this we are unable to see far objects. And myopia, also called nearsightedness, eye too long for refractive power of cornea and lens. Light focused in front of retina, correct with concave diverging lens. So in this we are unable to see near objects as the image is being made in front of the retina. So we have to diverge the rays, and the diverging lens is concave lens. So myopia concave and hyperopia convex. Astigmatism, it is the abnormal curvature of cornea, different refractive powers at different axes, correct with cylindrical lenses. So with cylindrical lenses we can correct this symptoms.